one of the issues that is a fact and prompted our call to you is that there is a metric in healthcare that is a standard, typical metric that we all measure ourselves against, and it's called a case mix index. And what that means in English is the severity of the patients we see. So the difference between a patient that has a gallbladder and a patient that needs a bone marrow transplant. There's obviously a significant difference in severity. Tufts Medical Center has the highest case mix index, or the highest acuity, of patients of all hospitals in Massachusetts, with the exception of the Dana-Farber. And as you know, the Dana-Farber is not a full-service hospital. It's very focused on just cancer. But of all full-service hospitals in the Commonwealth, Tufts has the highest acuity. And we think the reason for that is it's largely a referral hospital. We see very sick people. We do the most, if not close to the most, heart transplants of all medical centers in the region. In 2007, we did more heart transplants than the MGH, for example. We do lots of bone marrow transplants. We see lots of really sick little kids in our neonatal intensive care units. So the more routine care tends to be care that we push out to the communities, where the community hospitals are perfectly fine, have great outcomes, and can do a wonderful job. And the high acuity care is what tends to come into Tufts. While Chinatown is our neighborhood, and we see a lot of patients from the greater Chinatown neighborhood, the larger majority for us over other major academic medical centers is that we see this high-end stuff. So part of the factoring for us was the very, very high case mix index. On the other hand, we knew our reimbursement rates were extremely low. Lower than many community hospitals, some community hospitals within your readership area. But essentially, if 1.0 is the average of what an academic medical center with our case mix, this all what we call it case mix adjusted, so it's adjusted for the severity that we have, because you can't compare gallbladders to bone marrows. So if it's adjusted for case mix, if 1.0 is the average, then Tufts Medical Center was receiving 0.87, where other medical centers in the Commonwealth on average would be receiving 1.2, 1.3. So without giving you specific dollars, that gives you
how
it
was
measure.
Before the new agreement.
That's right. And I have signed a confidentiality agreement with Blue Cross, so I can't talk about the specifics.
You can't really say, even on your little number line there.
All I can say to you is that this is basically what I can say to you, is that I believe that we struck a deal that maintains our goal to be a low-cost provider, and at the same time is competitive and is a good opportunity for both the health plan to facilitate its goals and for the medical center to achieve those goals.
So when you say low cost, because of proprietary information, the public kind of has to trust you that you're low cost.
Well, actually, the websites for most of the health plans today do things like either have little dollar signs or stars, and they use it for different things. They'll use it for cost and they'll use it for quality, depending on what it is that they're measuring. So a website, and I don't know if you know off the top of your head, but I don't know if you go online with Blue Cross or Harvard or Tufts Health Plan or whatever, if they were to measure that, we would be shown to be on the efficient price side. Well,
So-
health plans also understand if you have a chronic problem, a chronic disease, and you get a call from an 800 line from a health plan, the data shows you're much less likely to take it seriously or warmly than if you get it from your doctor. People just gravitate toward getting this kind of management from their doctor. And the health plans are catching on to that, they understand, and that's why they're shifting the responsibility and giving the quality incentives to the doctors.
I think the other thing we've done as a network is actually today our first electronic health record practice goes live. So we've committed $28 million to this project to install a single electronic health record across all of our community practices and the academic medical center ambulatory care practices. So we'll be the only academic medical center network in the city to have a single record across both community and academic medical center ambulatory care practices. So we were able to negotiate a contract with vendors, a local vendor called eClinical Works, set up the system in such a way that we'll be able to advance our quality and efficiency goals and help the practices with some financial backing from the hospital, as well as our internal expertise that we've developed by hiring specialists who know how to implement electronic health record and practices, and helping the practices with those installations and use. So that's going to go on over the next 2 to 2.5 years. And at the end of that process, every single NEPO physician will be on the same electronic health record and be able to seamlessly communicate. We'll be able to send referral information back and forth. We'll be able to share problem lists, share allergy lists, share medications. It will avoid a lot of duplication of care because a specialist at the medical center will be able to look up and see, yes, this patient already had a nuclear cardiac scan at Quincy Hospital. I can just take a look at the result and I don't have to repeat that.
So you said it goes live today, but it's going to take 2 years to get all
The first practice goes live today.
Okay. Who's the first practice?
It's a practice on the Cape.